Hi everyone, welcome to Bio 160. We're going to be talking about the respiratory system today. Okay, so without further ado, let's get started, shall we? Okay, so this week we definitely going to be looking at the respiratory system, and these are the learning outcomes of the respiratory system that you're going to see. Okay, here we go. So the learning outcomes talks about the parts we're gonna looking at anatomy of the respiratory system, right? When we talk about anatomy, those are the parts that we have, right? The parts that we have, the features or functions of your nose, pharynx, your throat, your larynx, your voice box, trachea, bronchioles, and alveoli. Mechanical breathing. We're going to talk about internal versus external respiration, and then we're going to go into controlled breathing. And last but not least, we'll look at the pathology of the lungs. Okay. So first, let's look at the respiratory system functions. What are the function of your lungs? What does your lung do? Well, one, it's actually a passage, okay, passageway to and from your lungs. You have the trachea right here going down, bringing air to your lungs, and also breathing out and letting out air as well. Uh, it's also modified incoming air to make it kind of purifying it, cleaning it, make sure it's nice and clean, and it's also humidified as well. If you look at the air that you breathe in, the normal temperature outside versus your body temperature inside, what it does is actually kind of bring that moisture. You want to kind of put some moisture into your lungs, and also, last but not least, to kind of warm up the air as well, because the air outside most often time is tends to be cooler than your lungs itself. Remember, your body temperature is 98.6 degree Fahrenheit, and most often time, with the exception of Arizona here, sometime we have during the summer month it's a little bit more hotter outside than inside. Uh, but for the most part, you're trying to bring to kind of warm up the air, and that's what your body does as well. The main function is the gas exchange. It's exchange the gases in your lungs. Getting the oxygen in and removing some of those carbon dioxide. Okay, and then connect that to your external environment. So we're going to talk about components, which is the anatomy of your respiratory system. You have your nose, your pharynx, your larynx, trachea, bronchi, lungs, and alveoli. We're going to go down in that list. Okay, here we go. First is your nose, right? Your nose right here. So this is the visible part. You could actually see it easily. The air enters the nares, which is the hole, right? Those are called the nares, the nostril or the nares that going into the hole. Okay, in the nasal cavity, you have a septum called nasal septum that divide left and right, and some people have what we call a septal deviation, where you keep picking your nose with your finger. You pick enough time, that's going to create a little hole right here in the septum. You could actually play a little trick by put one finger in on the left side, and then it will poke out on the right side. And sometimes you might, um, spit up spaghetti or noodles. It might come out through that hole as well. Okay, so you have that septum. So don't try to pick your nose too many times. Okay, and then you have these concha. Concha, again, we learned this term is the nasal concha. You have the superior, which is on the top, the middle one in the middle, and then you have the inferior one on the bottom. And these have create a turbulence in the air, right? To help warm up the air in your nose. So the concha, the bone, and you have what we call a meatus right here. These are the meatus, superior, middle, and then inferior meatus. These three actually create that turbulence. The air become turbulence going through it, and then help warm up the air. Okay, to go down your lungs. Again, nasal concha, as I mentioned, there are three of them on your lateral walls. You have six of them on each side, okay, which just create that turbulence, which warm up the air inside your nose. Okay, you also have the palate, which is the hard palate and the soft palate. The hard is in the front part which is made of your palatine bone, and the soft palate is in the posterior region here, right, in the back part of your mouth. Okay, you have. I'm sorry, the palatine bone is in the back. You have the maxilla in the front. Okay, and then you have the smell. The smell is actually created by olfactory nerve that's dangling down. This is where the smell. You could see how thin it is from here to your brain. So if you mess this up, you snort too many illegal stuff like cocaine, meth, you're gonna damage this part right here, and then you're gonna have problems smelling. And COVID-19, the virus actually attacked these receptor right here of your olfactory nerve, so that cause people to have difficulty smelling when they have COVID 19. Okay. Again, the modified air will be humidified because of the nasal concha on the side. Those six bones, three bone on each side, help warm up the air. Okay, trap the airborne debris, smoke, dust. Will kind of clean the filter your air right here, and also adjust for the temperature as I mentioned. Okay. Now we're going down further down into your throat, right? Your throat have three sections. That's called the pharynx, your throat. And the first section is called the nasopharynx, which is right behind your nose. Oropharynx is right behind your mouth, which is right here. This is your oropharynx. And then you have the laryngopharynx, which is by your voice box, larynx, right? So you also have tonsil, something to note as well. You have three different tonsil here. The pharyngeal tonsil, which is called the adenoid tonsil, which I'll show you that picture in the next slide. That's part of your nasopharynx, a little bit higher. Then you have the palatine tonsil, which is the oropharynx, part of your oropharynx. And then you have the lingual tonsil, which is by your base of your tongue. Okay, you could see right here. Okay, so this is the pharyngeal tonsil, which is up way up here in your nose. Okay, the one that people often talk about is the palatine tonsil. This is the one that you can view from your mouth, and this is the one that sometimes things become a little sticky. Some people actually secreting like saliva and mucus all the time in that area, cause it to form what we call tonsillis, which is like little stone that kind of stuck in the back of your throat. Usually people spit that out. Okay, and that usually have a foul smelling stuff, like it smell like foot almost, because it's a collection of your saliva and many different kind of enzyme in there, like mucus as well, kind of trap all kinds of different things, so the bacteria grow on it very easily. And people usually even buy like stick to clean it, trying to stick, probe it out, uh, or using a Q-tip at home to spit it out as well. Okay, and this is the one that we remove. A lot of time, you only remove it when it's become really enlarged and then kind of block your airway, block uh, your mouth as the food going down in your airway as well. So, this is actually a tonsil, which means that this is where a lot of your lymphatic system actually live. So in the past, we keep just we take it out very quickly and easily back in the 90s, but now we're trying to keep it until it start kind of bothering you and blocking your airways. The last one is the lingual tonsil, which is underneath your tongue right here. Okay, so those are the three tonsil. Then you have the larynx, which is your voice box. Think of Larry likes to talk. So Larry likes to talk is your larynx. So this is where your vocal cords are. Okay, you have the um, true and false vocal cord. We're going to show you that. And then you have a structure that you should know for your test. Really highly recommend knowing, called epiglottis. Epiglottis is a little flap that actually opens when you talk, when you move, when you breathe. But when it closes down, when you swallow food, the moment you swallow food, that's epiglottis actually closed down to prevent food from going into your trachea. So this is your epiglottis in the front, your trachea also in the front. So this flap falls down to block food from going in here. So food will slide, go into your esophagus instead. not in your trachea. Okay. And sometimes this is when people, laugh and eat at the same time. When you're trying to eat, this is when you're trying to swallow down your food. But then when you're laughing, you actually need air coming out from your lungs to actually cause you to laugh from your vocal cord. And that's kind of like epiglottis, like, I don't know what to do. Do you want to swallow, or you want to just laugh? So which one? So usually they open it up, and then some of the food goes down, and that's when you have aspiration or choking. uh, right. So epiglottis, a big thing to know, a big one to know, definitely. This is again the structure up here that prevent food from going into your trachea. Okay, prevent food from you going into your airways, so you won't choke. Okay, you have the thyroid cartilage, which is this big, huge armor right here. This is called the thyroid cartilage. Okay, your Adam's apple. Okay, made out of hyaline cartilage. You have the cricoid, which is the softer tissue on the bottom here. Okay, the cricoid, which is ring around your trachea, and then you have the true vocal fold and false vocal cord. We're gonna look at those really quickly. Okay, good video to watch as well. You want to watch that video on the bottom. Again, this is the hyoid bone here. You have the epiglottis on the top. Okay, you have the thyroid cartilage. You have the cricoid cartilage right here on the bottom, and these are the trachea. Okay, this is called the sometimes we what we do is called cricothyrotomy. Cricothyrotomy is basically you poke a hole right here. So let's say someone actually choking up here, they can't breathe because something actually blocking their airways up here, and this is kind of emergency procedure where you feel this is your thyroid. You could feel the Adam's apple. You feel a little dip right there. This is the dip right here. It's a soft tissue between your thyroid cartilage and your cricoid cartilage. You could cut that open and then stick a straw in, and then that will help that person breathe again. Okay. Going from the back right here, you see the thyroid cartilage, the epiglottis, seeing clearly, and the cricoid cartilage from the back side. Okay. Okay, so with the larynx, again, you have two. The key things on this, you have two vocal cords. One is called the false, and then the other one is called the true vocal cords. Okay, uh, the true one is the one that vibrates the air and then causing sound. You actually hear your voice coming from that true vocal cord. Okay, the false one is that just kind of help close the airway, which is your glottis. Okay, when you swallow. Okay, so doesn't actually participate in terms of making sound per se, but does help, when you're swallowing down your food. Glottis is an opening between your vocal cords. That's called the glottis, and you're gonna see right here. So the glottis is the openings here, and you have the true vocal cord. Okay, which is this part right here. That's where the all the white part here that where it structs. Okay, and then you have the false vocal cord right next to it. Okay, so the way sound work is the way when we talk and when we sing is you vibrate. These vocal cords actually slam onto one another to create sound. Okay, to create sound, and the sound itself is pretty flat in terms of the sound. Is it doesn't have any tone to it. Okay, this is just like when you pluck a string, like when you pluck a guitar, right? Is give that generic sound. But if you want a signature sound, like let's say um, the voice of Beyonce, let's say, right? Uh, it's actually further up here on your face. Your facial structure is the one that dictates the tone of the voice, of how your voice actually sounds like. Okay, so just like when you play a guitar, right? You have a string on guitar. The string itself, well, it's just a string, but let's say you use different guitars to actually give a different sound, different characteristic of the sound is based on those the around surrounding structure, and actually based on your facial bone, So technically speaking, twins have exactly the same sound, or brother and sister sometimes they have the same sound because their facial structure are very much the same. So they could, you know, uh, have the same kind of tone, have kind of same kind of voice. Okay, so, so this is, you could see when it's open and when it closed, and then when they make sound. And when you hit some of the falsetto note really high, you actually could be slamming that vocal cord in, tens of thousand or even 100,000 per second per minute. Okay, to create those high notes. Okay, so your vocal cord is actually, you work a lot with your vocal cord. You uh, use use these a lot. Every time you sing in your shower, you sing when you drive, when you talk, you actually slam these vocal cords together many times each day. Next structure down is called a trachea. Trachea is the 4-inch long tube that connects with your larynx, your throat, and this is going to be a C-shaped cartilage. Okay, the C shape meaning that these cartilage is actually right in the front. This actually empty in the back. So think of a C like this, right? You have an empty backside, and that backside is sit where your esophagus actually is. So the backside is where the esophagus is. So that's where the C-shaped ring is. Okay, it lined with the ciliated mucus. So inside you actually have tiny little cell that have hair. Okay, this is called mucillary escalator. So when little particles comes down, these hair will actually move it on up. Okay, expelling out your dust and other small debris. Again, this is not like, the hair is so tiny, it's so like so microscopic, so it's not going to remove like a big, huge chunk, like let's say a piece of apple going down, and it's not going to be able to remove that because it's nice and big. So we're talking about like microscopic stuff, like little tiny dust or bacteria, even in some cases, can be removed by these little hair. Okay. Now we're going down into the lungs. The point that I wanted to kind of point out here, there's one that didn't cover in here, is called the carina. Carina is right here. It's a split between the primary bronchi. You have the left and the right primary bronchi here. Okay, so this point is called the carina. Okay, carina with the C. Okay, carina with the C. Okay. Oh, okay. So Karina, just think Karina likes to cough. So this is the coughing receptor spot, where anything when it touch that spot, you're gonna start coughing like crazy. So like a little water. Let's say you're laughing, you're drinking at the same time, and that water comes down here. When it hit the spot, you're gonna start coughing like no tomorrow. So Karina, think of Karina. C for Karina, C for cough. Okay. So you have the main two, the right and left bronchi. The right one is actually more straight down, okay, more vertically down, and whereas the left one is actually more off onto the side, okay. So if anything that's launched down onto your throat, more likely it's gonna go down onto the right side, because of more straight down kind of nature of the right bronchi, primary bronchi. Okay. So after it's split the first time, it's called the primary, and then when it's split again, it becomes the secondary, which is right here. When it's split the third time, then become tertiary. When it's split into a small one, we call the bronchioles, and then at the end, the very end, called the terminal bronchioles, and where you have your alveoli there. Okay, so again, the first split is primary, then second split is secondary, third split is tertiary, and then the next one, the little tiny branch called the bronchioles, and then you have the terminal bronchioles and then alveoli. Okay, so the last anatomy part is your lungs. Your lungs actually have occupy your thoracic cavity. You have the apex on the top, and then the base on the bottom. Okay, uh, so apex on the top, base on the bottom. Okay. The left lung has two lobes. You have the superior and inferior lobe. Okay. And then the right lungs, you have three lobes: superior, middle, and then inferior on the bottom. Okay. Um, And then you have two layers of the pleural cavities, the pleural, which mean like the sheet that covers the lung. So you have two layers. The outside one is called the parietal pleura. Parietal pleura, like on these right here, which is the thicker one. This is the really tough one. That's on the outside of the wall, your thoracic wall. Think of like when you buy electronic products, it come in a box, right? And then you have like, let's say you buy your iPhone or your smartphone, you come in a box, and that box is like parietal pleura. And then you have the visceral pleura, which is like a little sheet, the plastic sheet that cover your phone itself. That's the visceral pleura. Okay, and these two usually like to stay together. They have a fluid right in the middle. The yellow part is the fluid. So the purple inside, this is the visceral. You have parietal on the outside. Okay, so these two pleural layer resists from being pulled apart. So they like to stay together. They love being one another. So they don't want to pull apart. So they love just being together. Okay. Then we're gonna talk about the respiratory zone. The respiratory zone this is where you breathe. You actually your breathing come from this zone. Okay. You have these alveolar sac right here. These are sacs, right? You have alveolar ducts and sacs. Okay. The big thing that you need to know for alveoli. Alveoli actually are these little air sac. This is where you have your capillaries inside, and this is where you have one single layer thick, which is your simple squamous. Right, simple squamous is one single layer thick, and this is where the gases are exchanged at this point. Right, the oxygen and the CO2 going in and out. Okay, so this is the air and the blood kind of exchange from one another. Okay, you have the key things you want to remember. You have a dust cell. The dust cell. This is the macrophage. So this is the immune system. This is remember that macrophage is the Pac-Man that just love to eat anything, right? Love to eat any bad guys that coming in. So in your lungs you have these as well. So they kind of get anything that doesn't belong there, like any microbes that actually get inside your lung. These guys trying to prevent from spreading, so they trying to eat them up first. Okay, you also have type 1 and type 2 cells, and one of them is called type 2 is called the surfactant secreting cell. Surfactant is something you should know. Surfactant is actually a chemical, a lubrication for your lungs. Without your surfactant, every time you breathe in and out, right, your lungs expand and then come back in. It actually causes friction, a little friction rub. Oops, sorry, a little friction like this. Right, you'll hear the sound friction. So when you create friction, they create heat and then create pain as well. So you don't want that friction. So we have the surfactant that kind of keep that moisture in your lungs, prevent any friction. We developed this ever since about 26 weeks of gestation, and that's a key term to remember. 26 weeks of gestation. Why you should know this? Well, because at 26 weeks, okay, at 26 week, uh, this is your lungs start to working. This is where we saying that your lungs start to be able to breathe on its own. If the baby comes out before 26 weeks, the chances for that baby to survive is cut in half. Okay, cut in half because the lungs doesn't have that surfactant, so they cannot breathe by themselves, and you're gonna create a lot of friction inside the lungs. So we try to cook the baby as long as we can. So we try to keep the baby in the womb. We do everything we can to keep the baby in as long as we can, and especially past this 26 week magic number. So if we could pass the 26 week, the chances for baby to survive is much better. Okay. Okay, then we have the gas exchanges. You have the oxygen crossing the blood to deliver it to your body. You have your CO2, carbon dioxide, crossing the membrane to enter the alveoli. Okay, so to be removed from the body. So oxygen going in, CO2 going out, right? So that's how it works. Okay, there are four step of respiration, 4 steps of respiration. You have first one is ventilation. Ventilation means just breathing in and out, so the air coming into your lungs. That's called ventilations. So if you have ventilation problem, that means something is actually blocking that airways, blocking your tubes going into your lungs. Okay, then you have the second step, which is the external respiration. Right, external respiration is happen in your alveoli. This is where the gaseous exchange, the O2 coming in, the CO2 going out. That's the external respiration on the outside. Technically, it's outside because it's touching the outside world, right? Think of it that way. When we talk external, you think it's on the outside, like your face, but thinking like this is touching the outside, like your nose going in is touching the outside part. Then you have the transport, which is just transporting down your blood system, and then you're gonna have internal respiration. This is where it exchange with your tissue and your cells, right? Exchange with your tissue and your cells. Okay, so let's look at the next one, which is the first one is the ventilation. When we talk about ventilations, um, there's are two phases of ventilation. One is inhaling or inspiration or expiration. Expiration does mean you're dead. You mean you exhaling, was you breathing out, right? Expiration, which is exhalation, which is breathing out, right? So we're gonna talk about those mechanism. How are those works? Okay. Um, I'm gonna talk about a little bit of how the pressure and the airflow coming in as well, and in terms of the thoracic cavity. Okay. Okay. So let's looking at inhalation really quick right here. So the main muscle that actually help you breathe is your diaphragm. So when your diaphragm contracts, it's actually moved down. Okay. When your diaphragm contracts, it moves down, and everything expand. Your lungs actually, when the diaphragm moves down, your lungs actually expand. Your lungs become bigger, and there's something called a Boyle's law, which means that it's the volume and the pressure are inversely proportionate, right? When the volume goes up, the pressure goes down. Okay, when the volume of the lungs increases, okay, the lungs become bigger. Then the pressure inside your lungs actually lower. Okay, become lower, and then the air will travel from the outside, which is have a higher at that point, higher concentration, going into your nose and down to your lungs, which is at a lower concentration since your lung kind of expanded. Okay, that's how inhalation works. So technically, we take this for granted because, technically speaking, all you do is you contract the diaphragm in order for the air to come in to suck in the air. Technically speaking, right? So you're not really working to get that air in, and this is when people have COVID, and when people have like respiratory diseases, and then you have troubles breathing. You kind of have that fear of, you know, uncertainty. You don't know what's going to happen. You can't breathe out, you can't breathe in, you kind of stuck. um, you do everything you can trying to get the air in, but you couldn't get the air in, because of the pressure is not low enough for the air to go in into your lungs. Okay, and the reverse is true for expiration. Is all you have to do is let go, literally let go of your diaphragm, so your diaphragm will start to move up. When you relax and you let go of your diaphragm, your diaphragm moves up. Then your lungs become smaller. When your lungs become smaller, the pressure inside go higher, and when the pressure inside go higher than the outside pressure, then the air will rushes out. Okay, automatically. Okay. So again, we take this for granted. There are technically two type of expiration. Expiration is one is the passive, which is you just let go and then you breathe out automatically, or forced expiration, where you force the air out. You using all your muscle to squeeze that air out. Okay, squeeze out the air. So you kind of little using a little energy to squeeze out the air. The passive one is you don't use any energy at all. So exhalation, when you normally breathe out, you don't use any energy whatsoever. You just breathe out automatically. Okay, there are components that actually help you breathe, like your ribs, your intercostal muscles. We talk about that during the muscle chapter. You have the diaphragm, a big one to help you breathe, and your pleura and your lungs also can assist that as well. Okay, we talk about all of these already. We talk about how the inspiration work, where your diaphragm contracts and it pulls down, right, and then air comes in or external side. When you relax the diaphragm, you automatically breathe out. Um, you could actually have a forceful expiration, as I mentioned. You're just using all of your muscle, abdominal muscle, your external intercostal, to squeeze out the air, okay, and push out those air from your lungs. Um, okay, so oxygen. So when you breathe in, you actually loading oxygen into your bloodstream. Okay, when you breathe in, you're loading up the oxygen. So so oxygen always move from high to low concentration. High to low concentration. So so your alveoli has a high O2. Okay, it's going from the high O2 inside. Right here, you have a high O2 inside here, and then you have low O2 in the blood. Especially when you have these blood right here, your venous blood, your deoxygenated blood. So you have low O2, so the oxygen would just go in. Okay, um, and then the CO2 leave the blood again. As you come in, you have rich CO2. That means you have lots of CO2, and that CO2 wants to go out because you have low CO2 here in the alveoli. Okay, and then when the blood leave your body, this is when you have a high O2, right? High level in O2, and then low in CO2, right? Low in CO2 kind of makes sense because this is where you have rich in oxygenated blood, and this right here you have low O2, but you have high CO2 because this is when you're coming back to your lungs. You want to exchange for that oxygen. Okay. Again, oxygen leave the blood to enter the cells. This is where you have the high O2 and low O2 in the cells. That's why it moved from high to low. Things always move from high to low. So carbon dioxide enters the blood because you have high CO2 inside the cell and then low CO2 in the blood. Okay. And blood that go into the lungs, you're going to have high CO2 and low oxygen. That's your deoxygenated blood. Okay. These are the non-respiratory air, which is the gas movements. So these are just kind of reflexes and voluntary actions that uh, that things that we do on a daily basis. This is how we do them. So cough and sneeze. These are just how we clear the lungs debris, right? Crying is actually a emotionally induced mechanism. Laughing, you actually puff out little puff of air when you laugh. You you actually just pop out these little puff of air coming out. Hiccups. This is where you have uh, different rhythm between your lungs and your diaphragm. It doesn't actually sync up, so you have hiccups. And yawn, we still don't know a lot about yawns because um, it's part of your inspiration. People think at first that yawning because we need more oxygen, that's why we yawn, but turn out it's not true because if you look at your O2 sat, when you yawn, you still have the same amount of oxygen in your blood. Um, so it's kind of questionable why we yawn. It's probably certain part of our brain that create that yawn due to sleep. Okay. Next part we're going to talk about is the volume and capacity. Okay, volume and capacity of your lungs. So hang on tight. So on the left side of your screen, you're going to see the four volumes. Okay, these are the basic volume. The first one is called the IRV, the inspiratory reserve volume in blue. Okay, so the area in blue, so and you can see the graph kind of go up and down, and all of a sudden it go all the way up to in the blue part. This blue area represent the amount of air that you can, the maximum amount of air that you can pack into your lungs. Okay, when with one deep breath. Okay, so the amount of air that go beyond the normal breath. Okay, amount of air that you can pack into your lungs beyond your normal breath in one time. Okay, if I ask you to take a quick breathe, like normal breathe, and then you breathe in, breathe in, breathe in, breathe in. So you're gonna take that breath going in, all the way to the top. How much you could breathe in. As you can see, the volume kind of varies from person to person. The more you train, well trained or athletics, more likely, or meditation as well, more likely you actually could have more inspiratory reserve volume. And the abbreviation is IRV. Yeah, IRV. Next one is called the tidal volume. Tidal volume is your normal breath. You breathe in, breathe out. Okay. When the graph goes up, that's when you breathe in. When it comes down, that's when you breathe out. Inspiration, expiration, right? Going up, inspiration, down, expiration. And then going up, way up here, that's your inspiratory reserve volume. Okay. On the bottom end, you have the expiratory reserve volume, ERV. Okay, again, this is the maximum amount of air that you could breathe out at one time beyond your normal breath. Okay. Then the last one, this is your RV, which is residual volume. You have RV sitting on the bottom. Okay, RV sitting on the bottom of this curve. Okay, so RV residual volume right on the bottom. Okay, so this is if you empty out your lungs. Let's say I ask you to breathe all the air out. Keep breathing, breathing, breathing all the air out. You're doing the expiratory reserve volume. You're blowing out all the air. Even when you're blowing out all the air, you're gonna have these air sitting inside your lungs right here. Volume, this volume of air is prevent your lungs from collapsing. We have this volume of air since the day we born, and some of those air, the 25% of that air is still in there from the day we arrive on this planet. Uh, it's Lion King. So the day we born, we take that first breath, and that first breath of air that you have, how many years ago, based on your age, that air is still inside your lungs. Okay, that very air is still inside your lungs, and that air does not leave until your last breath, until you die. That's when those air will start creeping up at the end. Okay, so that air is going to stay with you. So that's the residual volume. Okay, so now we're going to talk about capacity. Okay, capacity are two or more volume added together. Okay, two or more volume added together. So first one is called the inspiratory capacity. Inspiratory capacity are the IRV plus tidal volume. Okay, IRV plus tidal volume. So basically, these two, okay, add up together equals to inspiratory capacity. So what does that mean? That is the maximum amount of breath that you could breathe in, including your normal breath. Okay, maximum amount of breath you could breathe in, including your normal breath. So how much air can you pack into your lungs? Okay, then you have the functional residual capacity, FRC, functional residual capacity. So this is the inspiratory reserve volume plus the residual volume. Okay, the RV and ERV added together. So what is this? So this is your normal breath. Okay, right? TV is your normal breath. So your normal breath is breathing. As you breathe normally, you always have this air inside your lungs. Okay, you breathe in, breathe out, and that air is inside your lungs. We call it functional residual capacity. So functional, the word functional, meaning that that's the daily thing you do. That's the amount of air you actually have and always have in your lungs when you breathe normally. When you breathe normally in your lungs, you have that much amount of air. Okay. Then you have the vital capacity. Your vital capacity, vital means you need it to stay alive, right? You need these to stay alive. So you need IRV, TV, and then ERV. These are the three volumes that add together. So this is basically, you need this in order to survive. Okay, so basically this include like when you know your normal breath, which is your TV, and then when you exercise, you breathe in more air, which is your IRV, and breathe out more air, which is your ERV. So it's including both of those. So these are the key component for you to stay alive. Okay, and then the last one you should know is called TLC, total lung capacity. So total lung capacity is all the volumes together, all four volume added together. We call it total lung capacity. Okay. Again, you could go through these and see what you come up with. Okay, based on what we talked about. Okay. So next one is the control of breathing. Control of breathing. So your control of breathing actually come from your brain. Okay, come from your brain. So come from your brain. That's the control of breathing. Okay, and it should know the location of your brain. One is the pons. Okay, pons helps smooth out the rhythm, and then medulla oblongata also set the rhythm as well. Okay, so smoothing out the rhythm and then setting the rhythms, knowing where those are, would be nice. Your nerves, you have the phrenic nerves that actually control your diaphragm. This is the one that causes the hiccup when your phrenic is not firing at the same time as your diaphragm does, and that's when you have hiccups. Okay. You also have intercostal nerve as well that control your intercostal muscles. Okay. Some of the term in respiration, you have eupnea, which I personally never hear anyone saying eupnea before, because hardly ever used in hospital or medical settings, because we always seeing abnormal stuff. So people, if they people have a normal breath, we just saying, okay, your respir, which is respiration rate is normal. Okay, we don't say eupnea. Okay, kind of weird. Hyperventilation, that's mean you just breathing really fast. Your normal breath usually between some people are between 12 to 20, 24 normally, and anything that above 20, 22, 24, that's considered hyperventilating, right? And you have uh, hyperpnea, which is you increase in volume, you breathe in a whole lot more. Okay. Physical factor in terms of non-neural factor of breathing, so not coming from your brain. What else can control your breath? Well, physically, you could actually, your body temperature can control your breath. When you actually when become hotter, you tend to hyperventilate a little bit more. When your body become hotter, you tend to breathe faster, right? Exercising causes you to breathe faster. Talking sometimes, like I'm doing now, causes me to breathe faster as well. Coughing, definitely, right? Um, you have other things like your emotion can actually speed up or slow down your breath. Your conscious control can also, let's say you're focusing on your breath and you're like, okay, I'm gonna breathe slowly, gonna breathe fast, so you could consciously control your breath as well, right? There's a chemoreceptor throughout your whole body as well, that detecting different chemicals that inside your body, like your CO2 and your O2. And usually we don't detect the O2, we detect the CO2 more so than your body, inside your body. Okay, and there's different location. One is your aortic arch, and the other one is your common carotid artery. Both of those, and they send a signal to your medulla oblongata for you to breathe faster or slower based on those levels. Okay, people when you're actually low on your O2, you may not even know it. That's why it's good to have your pulse ox at home, that little thing that measuring your finger to see how much oxygen you actually have, because we don't our majority of our receptor are not focusing on O2 as much, but focusing on CO2. And if your CO2 level is still normal, even though your O2 is down, you may not even feel it. But then, this is what happened to a lot of COVID patients. They don't even know it. COVID hits them. They're like, "Oh, I'm fine." But if you actually look at their O2, they're not fine. They need to be in hospital, and then usually that's what happened. Uh, they think they're okay, and then 2 days later they're not. Okay. Then you have the hyperventilation. This is hyper and hypo. Hyper is mean again you fast rate of breathing. That's more than 24 breaths a minute. Okay, that's not good. And usually the reason being is you have too much CO2 and you're trying to expel it out. So you actually breathing out a lot of CO2. Um, and if you have too much CO2, your blood will become acidic. Your body will become acidic. So that's right. You're trying to breathe out CO2 so that your body could become more basic instead. Okay. Hypoventilation is breathing really shallow or really slow. This is when you do that because of your CO2 start to increase, and your CO2 start to increase, you want to kind of breathe slower. Okay. And again, high CO2 make your blood become more acidic. Okay. We're going to talk about different pathologies, different diseases. That regarding to your lungs. The first one you should know is called COPD, chronic obstructive pulmonary disease. Okay, and this is usually caused by smoking. Okay, history of smoking. So usually this is caused by smoking, and it can lead to chronic bronchitis and can lead to emphysema as well. Okay, you're gonna see like labor breathing, difficulty breathing. They're coughing a lot. They have pulmonary infections are very common. What happened to them is depending on which one we're going to talk about more so with each one. So this is the normal lungs and this is your COPD lungs. Usually they have mucus that build up because they smoke a lot. They have these mucus building up in their alveoli. When they have mucus, then the air have trouble coming in. Okay, or they have this big huge alveoli, the air kind of stay in and then have trouble going out. Okay, so and it does get worse. The condition is chronic, meaning that it's gonna get worse and worse if you don't quit smoking. Okay, and this can also happen to secondhand smoker as well, which is more common now. We're seeing a lot of people who have get these because of secondhand smoke, and that eventually can lead to respiratory failure. Your lungs could shut down. Okay. Chronic bronchitis, again, this is caused by smoker. Okay, so this one they usually produce mucus and then prevent air from coming in, so they cannot breathe in. So they usually we call a blue bloater. So you want to write that down. Just a quick mnemonic to remember called blue. Okay, bloater. Okay, bloater, meaning that blue is like a Smurf, right? They don't get the oxygen. When they don't get oxygen, they become smurfs. They're turning blue. Bloater, meaning that because of they don't have the oxygen, and it caused them to have edema throughout your whole body. So you have edema everywhere, like they're bloating up, become liquid fill your whole body. Okay. So pneumonia very common. Risk of lung infections. You have mucus in your ventilations everywhere. Okay. Emphysema also caused by smoker. Smoker. One more note on this one. This one, we usually prescribe oxygen. Okay, they do need oxygen because they don't get the oxygen in. So these are the one that you see them have a little nasal cannula oxygen walking around. So and they continue to smoke, and oxygen and fire doesn't mix, so that could cause them to blow up. We have people blowing up their home on a yearly basis because they on oxygen tank and they still smoke at home. Okay, not good. Oxygen is flammable, very flammable. So pure oxygen. Okay, so the oxygen that you breathe in is not pure. It's actually mixed with nitrogen and CO2 and a whole bunch of other gases. So that's why it's not flammable. If take a fire and you light up, there's nothing happen. But the oxygen that we give to people is pure oxygen, completely pure. So nothing else but oxygen, and those are highly flammable, highly flammable. So emphysema again caused by smoking. Okay, caused by smoking. Um, Again, major cause of death, and usually they have labor breathing again, coughing, pulmonary infection. So these what we call a So blue bloater, right? This is called the pink puffer. So they're not blue, they're pink because they do get the oxygen. The oxygen come in, and puffer referring to their smoke, like chimney. So they is puffing like puffer, right? So pink puffer. So they do get the air in. The air comes in, but what happened is their alveoli, instead of like little tiny grapes like this, the walls of the alveoli start to disappear. Okay, start to merge into one. So what's happening is they are losing surface area. Think of like you have different rooms in your house, but you start breaking down the walls of those rooms. Okay, so now it becomes one big huge room. When you have this one big huge room, the air tends to trap here. Okay, the CO2 doesn't go out. Okay, so the CO2 tend to stay here. The oxygen does come in. The oxygen does exchange going to your blood, but the CO2 doesn't leave as much. So what do? They try to force out the air. They use their chest to force and squeeze out the air to come out. When they do that, they actually developed something called a barrel chest. Okay, barrel chest. So you're gonna see these guys have like nice thick middle part of their body look like a little barrel. Okay, little tiny barrel. If you want to see what that look like, go see picture of Elon Musk, right? Elon Musk. They look his chest look like a little barrel, like this. The reason being is because now the chest has to work harder to squeeze out that air. So when they're trying to work harder to squeeze out the air, that's when you have the barrel chest. Okay. Um, so again, they retain CO2. Okay, and they could end up having respiratory acidosis as well. The body become more acidic. Okay, and can lead to respiratory failure. Next one, you have asthma. Asthma is a childhood condition. This is the allergic condition. Usually, people who have this usually allergic to something. Okay, something is type 1 hypersensitivity, meaning that you have allergies to some pollen or something in the air. So what happened is you actually develop a hypersensitivity in your passage. You start to develop these mucus. The mucus here is not as thick as the one in chronic bronchitis. The chronic bronchitis you can see was green, thick green mucus. This one is more like a clear mucus. Okay, so these folks, okay, big thing is they could breathe in easily. Okay, they have problem breathing out. Okay, they have problem breathing out. They cannot breathe out because the airways start to traps down. And if you seeing them, if you actually hear most of them, okay, they could breathe in just fine. They go, but then when they breathe out, they have these wheeze like breathing out. So they can they could breathe in, but they cannot breathe out. Okay, uh, and that's the key thing for asthma. Okay. Um, Again, it's a response to irritant, meaning that they're allergic to something, okay, causing them to have this. Most people do grow out of it. Usually, when they become adult, they tend to grow out of asthma. Some people still carry that inhaler to kind of open up the airways so that you could breathe out easier. Okay, so then you have the aging effects. Aging effects just saying that, well, as we age, things kind of falling apart. Your lungs is not elastic anymore. Your volume that go into your lungs is not as much as it used to be. Okay, the oxygen levels are gonna go down. Right, you're gonna be hypoxia. You have sleep apnea. You can't get the air in while you sleep. You have easier to become infected as well. Then you have cancer. This one is cancer, which is a third of all cancer in the U.S. is the lung cancer. There's different type of lung cancer. The most common one is called the small cell carcinoma. Small cell carcinoma, and you have the squamous cell carcinoma, and the adenocarcinoma, which is a different layer and different layers of your lungs and different type of tissue in your epithelial cell in your lungs. Okay, and again, most of them is your smoking, which is cause the risk, or secondhand smoke tend to cause this. Last one is your vaping. Okay, these vaping is the new uh, the new vibe, the new trend. People vape a lot, right? They could get what we call popcorn lungs. So when you vape, you actually inhale a whole bunch of stuff, and then things are become superheated, those liquids, and could irritate your lung tissue, like a lot of stuff. Formaldehyde. This is a preservative that you actually smell in the cadavers, like dead bodies. Uh, we put that, in the cigarette. We put that in the vape to kind of preserve stuff that's in there, right? And you cannot get this out once it's into your body. It actually stay in your liver, it doesn't go out. And you have other things that can be bad for your lungs and your body as well. So what is popcorn lungs? Is the damage to your small airways, okay, of your lungs, okay, caused by these chemicals that you have that go into your lungs, and you could end up with these, right? You could end up with pneumonia, pneumothorax, or bronchiolitis that can damage your lungs. Okay, and that's it for this chapter. If you have any question, please let me know. And thank you again for watching. And I'll see you in the next one. Take care.